and that you communicate about the fact that touch and a hug and a kiss and a peck does not mean an invitation to be sexual together, that we can be demonstratively affectionate and still recognize that maybe we're struggling sexually. And back to those sort of gender differences. Some knowing glances from the audience. So I'm going to just quickly go over this slide because I know the previous presenters have done an excellent job at speaking to sort of the type of sexual dysfunction that couples struggle with, and men in particular, midlife. Decreased sexual activity, certainly as we age. We don't stay the 16-year-old in the back of the Chevy forever. And we tend to do other things like grocery shop and golf. So the bottom line is, one of my colleagues when I was training at UBC used to say, thank goodness we all aren't those 22 or 18-year-old kids, because none of us would have jobs and we wouldn't pay our bills, and right. So we end up with a more of a probably balanced sexual rhythm in our lives as we age. There is certainly in the research a tendency for individuals, men and women, to decrease the amount that they self-stimulate or masturbate. It's very, very important across the lifespan that is something that A, you feel comfortable doing, B, that you recognize as the most natural instinct in the world, and that you look at that as something that is actually preservative of your sexual health in general, and is also good for your health, right? What better way to get your heart pumping? I know Stacey and Mike have talked about hormones and the importance of hormones. At the same time, it's important if there is hormonal issues are ruled out at a GP or medical specialist level, to recognize that there are a lot of ways that our libido takes a hit. The sexual desire begins primarily in our brain, and it is really important to look at the context in which you are desiring. Are you stressed? Are you feeling disconnected from your partner? Are you worried about an elderly loved one? Are you bored? What's going on that could be other factors influencing your sexual desire? Diminished sexual response has been well covered. A tendency over time as we grow older to take longer to arouse. The intensity and possibly frequency of climaxing diminishes somewhat, although certainly couples midlife both continue to regularly climax that are communicative and work on their sex life. Rapid ejaculation, Mike's talked again about the prostate issues. Dyspareunia is sexual pain, and many women as they age tend to have issues with dryness. That has to do with the hormonal shifts, menopause and postmenopause, even in perimenopause for that matter. And that dryness can be quite exquisitely uncomfortable for some women. There can also be a thinning and sort of atrophy of the vaginal lining. And there are many, many ways that we can work with women to overcome these issues, or at least adapt. Some of them are hormonal treatments that you could speak with your GP or medical specialist about. Something as simple as regularly using a lubricant, taking more time, making sure that your head is present and that you have mental arousal is very important. So that's something that in many, many couples I see, her pain and the changes that she's enduring end up impacting on the couple themselves. He may not know what to do with it, still is wanting to be sexual with his partner, but certainly not ever wanting to have an encounter that ends up being painful for her. And if you're in that situation, please see your GP, and if possible, seek out specialist care in the community if it doesn't resolve. And of course, ED or other sexual dysfunction in a spouse can also be a big problem. Okay, I just wanted to really briefly talk about a couple of the gender differences that cause all sorts of trouble in our relationships from the time we're pretty young to the time that we're in our golden years. I talked a little bit earlier about the sort of men needing to be sexual to feel loved and loving, and women often needing to feel loved and loving in order to even think about being sexual. Well, believe it or not, there's a whole body of research on this. One of the most prolific researchers in this field right now is actually Dr. Rosemary Basson, who's one of Dr. Elliott's very close colleagues in Vancouver. And without going into it at great exhaustion, what she's identified is that we really are built psychologically and biologically quite different. For women, we tend to be receptively sexual more often than not. Our libido is more responsive. Now what that means is, the metaphor I often use with my patients, and everyone kind of gets it, is I call it the dreaded Christmas party syndrome. And the dreaded Christmas party syndrome is the sense when it's December 18th in Kelowna, gray, cloudy, raining probably, and you have to go to a Christmas party, get dressed, get yourself organized. And if it's the Christmas parties I go to, my husband's in dentistry, I may be going to listen for 3 or 4 hours to stories about root canals. So in my life, it really is the dreaded Christmas parties. And yet, if you kind of get yourself ready and put on a new dress and put on your boots and slosh through the sluck out there, and you get to the party, and before you know it, you've had a glass of wine, you're having a good time. Female libido's kind of like that. There's a lot of other things on our agenda as women, often, that supersede in importance and priority being sexual with our partner. But once we are open to being sexual, we're receptive to it, we're responsive, we might find that we actually had a better time than we thought. To quote one of my patients that I saw actually yesterday, Tuesday in the office, she said, Doc, I was going to watch Dancing with the Stars, but the night probably worked out better. Right? So that's sort of typical of female libido, in particular as we age. That's the way we're supposed to be. There's nothing wrong with it. That's the way we're built. Men, more stereotypically, tend to have a more spontaneous, or what we might call proceptive libido, a more appetite-based libido, seeking out. And that, of course, as with many things in men's lives, is probably hormonally based, primarily testosterone based. These things tend to soften, these differences in couples over time. And that can be a really, really good thing in the bedroom, because maybe both are now initiating. Both are looking at sexual intimacy as being something that's just part of the fabric of an overall good marriage and a good relationship. So it's important to both make the effort to initiate. When we initiate with our partner, we send a message more than just, yes, I will be sexual with you. We send a message that I adore you in a unique way, that you are special to me. And it's important that not just men with their healthy dose of testosterone, healthier at least later in life than women, but that also women say yes and initiate to nurture the sexual relationship. Also wanted to mention the not wanting to want. I see a lot of couples that come in, primarily women, often middle age, but often younger, who say, I just have no desire. It's not there, it's gone. And a famous retort in my office is, well, where did it go? That's what I'll say to my, is it in your pocket? Is it, right? Where is it? Cupboard at home? And they'll look at me. Desire, sexual desire, is something that all of us have. We're sexual beings. Many of us, at various stages of our relationship, turn off. We turn off because we don't want to want. We don't want to give the message that I desire you, I adore you, because maybe we are a bit angry that the garbage wasn't taken out. Or maybe we are still thinking about the argument that happened 3 months ago. So if you find that there is on either side in a relationship stonewalling, kind of emotional withdrawal, and that leads into the bedroom, again, it's really important to get some support. And it doesn't have to be coming and seeing a psychologist like myself. It can be talking to a really good friend, another couple, seeking advice from a trusted older pastoral counselor, something like that. But make sure that you deal with it. And I've mentioned throughout my talk today that adapting and understanding the very real and normal changes, age-related, in terms of your sexual health is also important. And having a focus on the process, the enjoyment, the sensuality of the experience, not the outcome, not the production of it, is really important. We in North America are super intercourse focused.